Hi, everybody. I'm Eren Berber, and I would like to talk to you about the just culture and how it decreases complications in the operating room. These are my conflicts, which are not relevant to this talk. First of all, let's define the just culture. For years, the surgeons have functioned within a negative blame culture where the goal of the system was to find the culprit for every mistake created with minimum learning included in this process. This blame culture, unfortunately, in healthcare has been a major source of unacceptably high number of medical errors. Over the past years, a just culture has emerged, which is an imperative to improve the quality and safety of patient care. It is defined as an environment supportive of open dialogue to facilitate safer practices. It is also termed as psychological safety, a supportive work unit in which members believe they can question existing practices, express concerns, and admit mistakes without suffering ridicule or punishment. An organization with a greater ability to learn from incidents is likely to have fewer incidents having an adverse effect on patients. Learning from potential and lower severity incidents then could lead to system improvements that will reduce the risk of adverse events. The safety culture is part of the daily routine at the Cleveland Clinic, where there is high reliability, and the employees as well as the caregivers listen to each other, learn from each other, and lead together. This is a blame-free environment where everybody is accountable and there is no punishment. Cleveland Clinic Patient Safety and Risk Management Office does continuous education on the safety goals throughout the year, where there's an annual exercise that targets all caregivers, and these are also communicated to the physicians and the caregivers via monthly emails. Every caregiver in a high reliability organization finds what could go wrong, speaks up, and works to achieve consistent excellence every year. This is the bottom line for the Cleveland Clinic Patient Safety Initiative and the Just Culture. Everybody listens to each other, everybody learns from each other, and they all lead together. Any Cleveland Clinic caregiver who recognizes an opportunity to improve a process or an event can log into any workstation and anonymously enter the details of the event, which goes to the patient safety office and review. This is such a critical part of the culture at the Cleveland Clinic that it's also emphasized as the first teaching materials to the graduate physician's manual. This manual is given to the physicians that are recruited to Cleveland Clinic. And the relevant paragraphs summarize that Cleveland Clinic supports a culture of safety with the elements including teamwork, high reliability, patient and family care, accountability, and a just culture where everybody is encouraged speaking up and to learn from this full cycle of reported events. The Cleveland Clinic Safety and Risk Management Office website also categorizes the event submitted as, for instance, as a near miss or a good catch event type. In 2019, this initiative achieved over 50,000 safety events being reported, 3,000 good catches being identified. The goal was to eliminate sentinel safety events, learn from good catches, disseminate the lessons learned, and encourage everybody to speak up. The risk management workflow involves event notification, initial review, and event investigation, root cause analysis to determine if the event is a sentinel safety event, action plan, and implementation and monitoring. As part of this program is a checklist that is filled out for every surgical procedure at the Cleveland Clinic. This safety checklist ensures that the correct patient, the correct site, and the correct procedure are identified, as well as ensuring that the standard procedural protocols are followed, including anesthesia assessment, evaluation of the implants, devices, antibiotic administration, potential blood products discussion, compression stockings application. The completeness and the correctness of this checklist is verified by two members of the surgical team, most frequently the attending surgeon and the circulating nurse. This checklist is also available as an app that the caregivers can download into their Cleveland Clinic phones. The goal of obviously this program is to get down to 0 events in the operating room. But how do we get down to 0 events? We have to listen to patients and caregivers. We have to learn when things go wrong. We have to lead the way to psychological safety. We have to embrace the tools we know. And we also have to focus on the safety culture and make this really the culture of the enterprise. Surgical operations is a critical part of this implementation and monitoring team. This is a dashboard that surgical operations reviews related to these events. Each of these events is also explained in more detail within this dashboard, where the leadership can also see the trends over time. If we review these metrics that are being collected, wrong side surgery, retained foreign body, other serious safety events, falls with significant harm, hand hygiene, code RAS compliance. This is the protocol that is instituted once there is an error in the count in the procedure, where an X-ray is routinely obtained and the radiology staff communicates the findings to the surgery staff. And this is documented. Count discrepancies, safety checklist audits, or acquired pressure injuries, burns, needle stick injuries, sharp injuries in the operating room, splash injuries, medication events, and eyewear audits. All of these metrics are also associated with a goal, which can be also monitored related to year-to-date progress. This is a critical graph showing how we can determine if the enterprise is going in the right direction or not by displaying the SIRS harm ratio graphic. SIRS safety event reporting system harm ratio is a ratio of more severe events divided by less severe events. If you remember the level of these events, level 1 is a near miss, level 2 no harm, level 3 temporary harm, level 4 significant harm, level 5 is death. And over time, as you can see, for the Cleveland Clinic, surgical operations, for all units, this ratio was brought down over time, suggesting the enterprise is going in the right direction and is learning from its mistakes. And this slide shows how the just culture can decrease the complications. The orange line is the number of safety events reported, and the blue line is the harm ratio over time. This is for the whole Cleveland Clinic enterprise over the past decade, since this culture has been implemented. And you can see over time, with the recognition of this culture and the implementation of the culture, there has been a significant increase in the number of these events being reported. You can also see that, especially after a new hospital joined Cleveland Clinic, with the implementation of the culture in that hospital as well, there was a tremendous increase in the number of reports. As a result of this tremendous learning process and over time, the whole enterprise has decreased its harms ratio significantly. In conclusion, the just culture has revolutionized the attitude of caregivers in the operating room. By creating a democratic environment that oversees the practices and procedures, it has motivated the caregivers to take ownership and be accountable. The data show that just culture improves the way the system functions and decreases complications in the operating room. I would like to acknowledge the contributions of the Cleveland Clinic Patient Safety and Clinical Risk Management Office and its leadership. Thank you.